Yvette. I wanted to comment on your ethical dilemma about placing a feeding tube in a patient with advanced dementia and Alzheimer's. From personal experience, my husband's grandmother was diagnosed at 72 with dementia. She lived until she was 88 years old. For most of that time, she lived with his aunt in her home, and she had a great quality of life. But towards the end, she started falling and needing more assistance, and was placed into a nursing home that could care for dementia patients. The last 6 months of her life, she forgot how to eat her food. So the discussion was, should they place a feeding tube for nutrition? However, they decided against this because she could still drink out of a straw. So she drank Ensure daily, 3 times a day as her meals, or as often as she wanted it in between. I do agree with you that by placing the feeding tube and not having these patients eat and interact with family members or caretakers takes away from the patient, because in the long run, they're going to pass away from this disease, and it's not going to help them much longer. Your provisions for the ANA applies to provision 1, 1.1, 1.2, and 1.3, but it also applies to provision 4, 4.2, accountability for nursing judgments, decisions, and actions, the beneficiaries, doing what benefits the patient. Does placing this feeding tube benefit this patient? What will they get out of it? If it's not going to benefit them, extend their life, improve their life any, is it worth doing a procedure that can cause pain and harm to them? PEG tubes get pulled out. Patients with dementia forget they have them and they yank them out. We've gotten plenty of them in the ER where these PEG tubes are placed back in, and causes them even more pain and discomfort. So what do they actually get out of benefiting from placing this PEG tube, their feeding tube, for these patients? And that's one of the other things you have to look at, what benefits these patients. If they're not going to benefit from this, if it's not going to improve their quality of life, should they be put through a procedure to extend their life when they're not really going to have great quality?